You just drop the entirety of the solution.
It is proven to save lives. Narcan, or its generic name naloxone, is a drug in high demand.
We've trained thousands of folks, and we've seen 420 plus overdose reversals.
Melinda Ruger is with Harm Reduction Services, or HRS. Their program trains people how to administer Narcan. And anyone who goes through their training, like this session earlier this year in Davis, gets 2 free doses of the drug. New versions like Narcan nasal spray and auto-injectors are easier to use, but nonprofits like HRS cannot afford them.
When you're talking about double, triple, quadruple the price point, it's just impossible.
With the number of people using opiates at epidemic proportions, along with the influx of artificial drugs like fentanyl, more and more people are overdosing, which means more and more people are in need of naloxone. But the price, even the cheaper injectable version, is becoming a big problem.
Naloxone is off patent, so it's open for competition. It's been around for over 40 years. But even still, there aren't that many competitors.
Ravi Gupta co-authored this study in the New England Journal of Medicine, which shows prices of naloxone have gone up significantly in the past 3 to 5 years.
Demand has certainly gone up. And so I think this is just a response to the fact that demand has gone up and the market allows for this to happen. And so companies take advantage of it.
The injections, like the ones Harm Reduction Services use, have gone up 129%. Yet compared to other versions, still affordable, roughly $14 a vial. The FDA-approved nasal spray, which has remained consistent in price, is $150 per prescription. The Narcan auto-injector, similar to what you might see in an EpiPen, saw a 500% increase in just 3 years, from $690 to $4,500.
We need Narcan more than ever, and we just don't simply have enough. We don't have the resources to purchase it.
Leanna Wen with the Baltimore, Maryland City Health Department is seeing the results of those costs firsthand. Baltimore used a so-called off-label version of naloxone, which turned the injectable drug into a nasal spray. But that version skyrocketed in price too, the generic now costing the same as the name brand. And now the city is running out of money and running out of Narcan.
Every single day, I get dozens of calls to the Baltimore City Health Department asking us for this medication. Nonprofit groups, neighborhood associations, faith leaders, they're saying that they have people overdosing in their congregation outside of their facility, and they want to have this medication available. I have to say that I'm sorry, I just don't have enough available.
KCRA3 reached out to manufacturers whose naloxone went up in cost. Pfizer, who bought one of the manufacturers in 2015, says their injection is typically used by first responders because it is a vial intended to be administered in a hospital setting. The makers of the auto-injector Evzio, which increased in price by 500%, says insurance generally pays for the drug. In a statement, they say patients who do not have government or commercial insurance and have a household income of less than $100,000 can receive Evzio for zero out of pocket. For those paying cash, the price is $360.
The insidious part of this is that if insurance companies are, for example, covering the drug, then premiums are still going up if the drug is expensive. And so patients are still paying for it in the back end.
In our program, there have been times when we've been almost ran out. There are times that we have come really, really close.
Melinda Ruger says as the number of overdoses continues to rise, the number of people asking for the drug rises with it, many of whom simply cannot afford to pay for the drug.
We serve a population that may have no insurance at all. So we're really leaving a whole lot of marginalized community members out when we're hiking the prices like that.
Tony Valier, KCRA 3 News.